Hello, everyone. Welcome to today's Global Ground Rounds. My name is Aisha Siad, and I'll be your host for today. Before we start, I'd like to go over a few things. So this presentation is going to be recorded and uploaded to our YouTube channel, as well as Figure One. If you watch our videos on YouTube, please remember that there's an option of playback speed to adjust the speed of the presentation. And on Zoom, you can turn on closed captioning during the presentation to allow for subtitles. So I'm going to go ahead and introduce one of our speakers, Melissa Kruetz. Melissa was born and raised in Southern California. She graduated with a degree in biopsychology, cognition, and neuroscience from the University of Michigan, where she was a student athlete as a member of the women's soccer team. Melissa is passionate about serving the military community as her brother served in the United States Marine Corps. Additionally, she is deeply passionate about serving the disabled community. Before entering medical school, she collaborated with researchers at California State University, Northridge, to explore the challenges that historically marginalized populations encountered when accessing services for children with developmental disabilities. Presently, as a student leader at Thrive Adaptive, she provides medical assistance at adaptive sporting events and advocates for improved care for individuals with disabilities among clinical professionals. Melissa is currently in her third year of medical school at Western U of Health Sciences in Pomona, California, and she hopes to pursue a residency in neurology. Also, fun fact, she studied American Sign Language for 5 years.
Okay, great. Thank you. So good morning. My presentation today, I know you kind of heard a little bit of my background in supporting the disability community. So I'm taking a look at it of how telehealth can help support and optimize services for this community. And on this first slide, I just wanted to include a lot of pictures that kind of depict that disability really looks like a lot of different things. So you can have, prosthetics, you can be in a wheelchair. These people are using sign language, they're deaf, blind, sometimes like Down syndrome or intellectual disabilities. So it really is a wide branching community. And then I just wanted to jump into the definition from the Americans with Disabilities Act of what a disability is. So a person with a disability is someone who has a physical or mental impairment that substantially limits one or more major life activities. They can also have a history of such impairment if they have cancer and they're in remission, or they are perceived by others of having this impairment. So someone who has scars from a severe burn. And then I would just break down what substantially limits. It was kind of meant to be interpreted broadly, so it's not this very strict standard. And major life events or activities are things that you do every day. So anything from eating, sleeping, walking, your cognitive functions, thinking, seeing, hearing, your ability to work, read, learn, communicate, your bodily functions. So it really is, this is also a broad range, but just so we have understanding of what disability is. And then we're going to jump straight into a case example. So this is obviously a made-up name, but Jackson Smith. So he is a 28-year-old male with a spinal cord injury at T10. And this is from a motorcycle accident 6 years ago. And he's here for a routine appointment to manage this chronic condition. You see him, he uses his upper body to transport himself from his wheelchair to the exam table. And he's also apologizing for being late because he must depend on a transportation service to get to appointments, but unfortunately, this service is typically unreliable and often late. What she expresses to you is really frustrating because it makes it really difficult for him to go out and even have the motivation to want to go out of the house. He has a home health nurse that comes to his house daily to assist with his care. And he expresses to you that lately he's been feeling some increasing sadness and he's missing out on doing some of the things he used to do before his injury, like sports and just being able to engage with others in his community. So next, we're just going to take a look at kind of past medical history. So oftentimes individuals with spinal cord injuries will have different comorbidities, and we'll talk about a few of them here in this example. So he has neuropathic pain and spasticity, and so for that, he's taking pregabalin and baclofen. He also has dyslipidemia, so his LDL is elevated. He's currently taking atorvastatin, and he's been encouraged to participate in some adaptive physical activity. He's pre-diabetic, so his A1C is 6. And again, just kind of encouraging him to take part in activities. And this dyslipidemia and prediabetes or diabetes is something that's commonly seen within individuals if they're not being active, obviously if they're limited by whatever that disability is. And then he has depression, so he's taking duloxetine. And then he has some pressure wounds, particularly on bilateral heels, and those he's just getting daily dressing changes. And then he has urinary and GI dysfunction. So he's often having some urinary incontinence, but for that, he's taking oxybutynin, and he's also doing intermittent catheterization. He also has constipation, and for that, he's taking Miralax, and he's increasing his fiber in his diet. So these are some common things that you would see with someone with a spinal cord injury. So now we're going to kind of dive a little bit more into his history. So review of systems, we're asking him respiratory-wise. He denies having difficulty breathing or clearing secretions, and sometimes people, if they have maybe a higher up spinal cord injury, those muscles for breathing are sometimes impacted. So that's always something you want to ask about. Musculoskeletal wise, he does admit that he's noticing some more muscle atrophy in his bilateral legs, so it makes sense if you're not using them. And then psych, because he's kind of expressing these feelings of sadness, we just want to always check in. He says he denies thoughts of harming self or others. Social history, he denies using alcohol, tobacco, or recreational drugs. Currently, he's unemployed, and prior to his injury, he loved playing sports, especially surfing. And he had a community of friends through sports. And he said one day he tried to go to the beach, but his wheelchair couldn't go on the sand. And so he feels like he can't enjoy the same things that he used to. And that's like adding to all of these feelings of depression and sadness that he's experiencing. We go into some family history. So his dad just has some hypertension that's managed. His mom's healthy, no allergies, and no past surgical physical exam. So vital signs look good. In general, he's no apparent distress. You do notice that atrophy in his legs, and you notice it a little bit in his lower abdomen. Cardiovascular-wise, his pulses, dorsalis pedis, and radial pulses are 2 out of 3. Heart sounds good. Respiratory-wise, we're not hearing any wheezes or crackles. It sounds clear. Neuro, we do notice that he doesn't have sensation from pretty much below the umbilicus to his toes bilaterally. And then his patella reflex is actually increased, so it's a 3 out of 4. And then we notice that we find the Babinski reflex on both feet. And then we look and we do see those bilateral pressure wounds on his posterior ankles. We do a GI exam. His abdomen's non-distended. We don't see any scars or bruises, and he's non-tender to palpation throughout. So next, let's see, what do we do next, and how can we use telemed to help our patient in this situation? So I put down some considerations of using telehealth or how it can help. So telehealth, I think, is something that can help empower individuals with disabilities to be independent. And this is really crucial when it's something that's chronic like this, where it can really help them just have an improved quality of life and help with their coping skills, because sometimes they have to be dependent on other people for certain reasons. But the more that we can help them, just be self-advocates and be as independent and have the best quality of life, that's ultimately our goal. And then the disability community has specific needs that require more healthcare visits than people without. So I think using telehealth is actually great because they, in general, are just going to have a higher demand for it. And then we also need to think about how we can make telehealth accessible, because there's different needs. So if people are deaf or hard of hearing, blind, intellectually disabled, we have to think about how we can make the platform accessible for them. And I think that's something that we want to ask each individual patient, is how we can make it most accessible to them, because I think, just don't be afraid to ask. And then people with disabilities are more likely to live at or below the poverty line. So we have to understand that this might impact their likelihood to own a computer or phone or have internet access. So something we want to be aware of. I know there's a lot of resources out there that we can supply them to help with getting these things. And then in the disability community, mental health conditions are common. So, or they might have individuals with different behavioral needs. So if they need like group therapies where they're learning like social skills or they're learning life skills. I know like when I was working prior to med school, a lot of individuals with intellectual or developmental disabilities, sometimes those were a lot of the supports that they needed, or if they need speech therapy or there's a lot of actual like resources that they need, and sometimes that can be a busy schedule. But so if they need those, or like we're just saying, sometimes it can be really hard on your mental health because it's this huge change in your life and you're not getting to do the same things that you were able to do. And there's some feelings of loss. And so I think mental health is something that if we can help support it, especially with something like telehealth, where we can bring it to them, and it's also not something that they have to worry about like getting transportation for, I think would be really great. So we'll go through kind of the plan for him. So we'll order the basic labs and imaging. We want to just get a CMP, CBC, A1C, and then another thing to consider with individuals who are not weight bearing is that they might like lose some of their bone density. So we want to make sure we're getting a DEXA scan. And then something we can do is we can share resources with this patient about adaptive sports organizations, because not only is this going to help, strengthen his muscles and help with all those other like comorbidities that we're talking about with the like dyslipidemia and the prediabetes, but we're now providing him a community, and this will help like support his quality of life, because ultimately like that's our goal. Like we want them to be living whatever life they want to live and how we can support that. So can we help him get a wheelchair that might be more accessible, where it can have like a modality where it can go on sand, or just different things that we can help them? Because I think one of the things that I've observed in my experiences is that sometimes the health perspective is like we do basically the minimum for them to be alive or surviving, so like to get around their house, but then that doesn't always optimize what adaptations we need to help them live the life they want or do the things they want. So they shouldn't be limited. So as healthcare providers, I think it's really important that we understand that and we do what we can to help them live that life. And then I think we want to offer future visits to be done through telehealth, ensuring to ask and consider how we can best meet the specific needs of the patient. And in this sense, I think it would be really good if we know he already has a home health nurse coming, we can have them maybe help us with doing some more of a physical exam or assessing for things like pressure wounds, so that, maybe if that might be something that's harder to do over telehealth, we still have someone there that we can just communicate and have a partnership with. And then I think we go ahead and we tell them we'll have a follow-up in 2 weeks through telehealth and try it out and just see how that goes. And then this is actually some pictures from a group that does adaptive surfing. And so you can see that they have like the surfboard here where you have some things for them to hold on to, and then a group of people help pull the board out and then help them, like push them, propel them with fins to get them riding on the wave. And then this is an example on the bottom of what the wheelchair can look like that can go on the sand. And so you can still be out there and do the things that they love. And then last thing, just talking about some considerations with culture and disability. So like one of the things that's always important to like always ask, don't assume, which is pretty much anything I think in life, but this is an example of where you can apply it. Some people prefer to be spoken to with person first language, so saying a person with autism, but some people really see their disability as a source of pride, so they would prefer to be called an autistic man. So always best to just ask what they prefer. And it's good to also understand that some communities within the disability community, like the deaf culture, have their own language and their own community. And so sometimes these groups can be very secular. So it's just important to understand that and respect it. And then consider how the medical model might come across as trying to fix something that's broken. But this conveys the idea that a person is broken because they have a disability. So I know that's something I think it's universal with any disability, but especially I think the deaf culture is very strongly like against like cochlear implant, because they're trying to say like from their perspective, they think that being deaf isn't anything that's broken, it's just different. But then when you have a doctor that's coming up and saying like, oh, well, let's fix this, like you can't hear, so we need to be like everyone else in the hearing community, so let's give you this cochlear implant to help. So just understanding like sometimes how things can come across and making sure that we're respectful and, understanding of what different cultures perceive things as. And then I think it's also important to understand that we want to promote inclusion whenever and wherever. So even the idea of adaptive sports, it's not so much about like creating a separate arena almost for like individuals with disabilities, but it's about including like everyone, so people with disabilities, people without disabilities, and how we can just, because that's also just going to enhance like community, or how we can incorporate, like I know there used to be, or sometimes I don't know exactly in the school system if there's still separate classrooms for like special needs versus the core group that's going through. So I think, promoting inclusion where we can have like an environment that's adaptive to the needs of different individuals, but also promote that, we're all going through it together. And so I think wherever you can do that is great. And then understand that some cultures might not be accepting of a disability. So some individuals or families might struggle with this. And so that's something to be aware of, because a parent could bring a child in and maybe feel some guilt or shame of whatever their culture looks at disability as. So that's something else just to be aware of. And I think it's important to know that the disability community is traditionally underserved and marginalized. So like, just historically, they haven't always had the best, relationship with healthcare and just in society. So it's something that we need to be aware of and culturally competent. And then, yeah, that's the end of my presentation. So if anyone has any questions or discussion, then let me know.
All right, so I see one in the chat from Dr. Pecchia. For labs and imaging, could these services also be brought to this patient's home and bedside to continue to address his access issues?
Yeah, I mean, that's something we talked about with one of the newer devices. I think it was called the Piccolo, where you can get blood from home, or even if we can have like his home health nurse draw blood. I don't know too much about how a DEXA scan can be done remotely like that, but I think some of the other core tests that we talked about can definitely be done at home and just reduce that barrier of him needing to get transportation to a place.
You any more questions?
Yes, I have a simple question. Is it okay? Can you hear me? Okay, yes. So my question is, do you do kind of rehabilitation? Like, do you do rehabilitation program for those people with such disabilities? And so how do you incorporate them into the community? So, and how do such people join into the program? So like, do you have a special way of identifying them from the community and then you enroll them, you do rehabilitation? So how do you basically incorporate them into the program? Thank you.
So at least what I do, I don't work directly with like the rehab centers, but typically I think these patients would also have like a PMNR, so physical medicine and rehab doctor, that specifically would be in charge of kind of those roles. But I know, at least in terms of like the inclusion aspect of like incorporating them with the community, like at the events, like the adaptive sporting events, it's very much encouraged for like anyone to play. So like I've even joined in where we're playing like wheelchair basketball, and they say just grab they typically have extra wheelchairs there. So they say just like get in a chair and like join in on the game with us. So the community is very welcoming too. So I think, at least, I don't know if I answered your question correctly, but in terms of incorporating with the community, that's at least how I've seen it done.
And I see a question from Catherine. Where can providers find local resources, for example, the adaptive sports that you mentioned?
Yeah, so I think there's a lot. So one of the things, there's like things called regional centers where they kind of help families with children and getting them connected to resources. And that's kind of where like the state helps provide funding for all of these different like support services they need. So whether that's through them directly, or if you, like, I know like when I was working at CSUN, we had like a resource center. So you can kind of just like look into maybe your local like community, or I'm sure like all of our resource centers are connected with regional centers. So that's one way to kind of just, if we as healthcare providers can get that number, get that contact information to then give to patients, I think that helps overcome some barriers. And they usually have like a lot of the resources in one place. So yeah, definitely would recommend that.
This isn't a question, but more like a comment. I have a nephew who has autism, and what you were saying about inclusion, I think, is very valuable, not just like in the medical space, but also like education, for example. I think you were mentioning how a lot of times they'd have like different separate like special ed courses for students, and I feel like it should be more inclusive and have, everyone in the same classroom, or have people or have the students do more activities together, because it feels very isolating for people with disabilities. And I'm just very happy that you mentioned that. So thank you.
Yeah, of course. Yeah, there's so many, I think, areas where we don't always think of it at first, but I think just the more that we can promote it wherever. Like this is just like one example within education, but I really think anywhere in society, the more that we can promote it is better. Well, thank you guys.
Thank you very much for just an amazing presentation today. Dr. Pecchia put in the chat, thank you all for your attendance and interest in today's programs and topics. And then also thank you, Anna Joseph from Figure One, for supporting new evolving cases and collaborations and continuing medical education strategies. So you can go ahead and join Figure One using the link that's in the chat. Figure One, you'll be able to get CME credit by looking at similar cases on the website. If you have any questions, go ahead and email Anna Joseph. Her email is in the chat as well. And feel free to share these Global Ground Rounds, the recorded ones and the current ones, for future sessions with your colleagues, as well as Global Offsite Care's mission and activities. With that is all. Thank you all very much.